Hello everyone. Today on the occasion of World Cancer Day, we have amongst us our medical expert Dr. Sampada Dessai, consultant gynecological cancer and robotic surgeon. She is here with us to bust some myths about cancer. And should we begin, doctor?
Yeah.
Starting with the first myth, cancer is a death sentence.
Cancer is not always terminal. It can be cured if it is detected in the early stages. Whether the cancer will be cured, to what extent it will be cured, depend upon the type of cancer and the stage at which it is detected. Certain cancers like testicular cancer or germ cell tumor of the ovaries are cured to a great extent. But some cancers like pancreatic cancers are less curable.
Moving on to the next, cancer is contagious.
No, cancer is not contagious. It cannot be spread from one person to another. However, there are some cancers which are caused by virus like cervical cancer or penile cancers which is caused by human papilloma virus, or hepatitis B virus causes hepatocellular carcinoma. These cancers are not contagious, but the virus producing it are contagious.
So the next myth is cancer runs in families.
Yes, certain kind of cancers can run in families, but it forms a very small proportion. About 3 to 5% of the cancers might run in families. And these are not all cancers. Only a few type of cancer and more familial predisposition like ovarian cancer, endometrial cancer, pancreatic cancer might have genetic predisposition.
So the next myth is cancer always comes back or recurs.
Different type of cancers have a different ability to be cured. Also, different cancers have different time frames in which it comes back. It is very difficult to know which cancer will be cured or which cancer will come back.
Herbal medications can cure cancer.
No, as of now, we do not have any evidence that the herbal medication can cure cancer. But alternative therapies like acupuncture, yoga, meditation can help patients to relieve the psychological stress that they have at the cancer diagnosis or decrease the side effects that they get from the cancer treatment.
The next myth is a commonly asked question. People who have cancer should not eat sugar.
More research is needed to know the exact relationship between the sugar and cancer recurrence. As of now, there is no evidence that eating sugar in a patient who already has a cancer will increase the chance of recurrence. But yes, sugar does cause obesity, insulin resistance, and these are the risk factors for development of cancer.
Cancer lumps are painful.
Most of the time, there is no pain in the cancerous lump. So any lump, whether it is painful or painless, which is come new or which is there for a very long time or is growing very fast, needs to be evaluated.
Use of mobile causes cancer.
No, mobiles releases non-ionizing radiation and it does not cause cancer. It is the ionizing radiation that causes cancer. So mobile is not proven to cause any cancer.
Thank you very much for busting so many myths about cancer today.
Thank you.